Hello, I'm Dr. Harris, and I'm a family medicine physician at Crossroads Medical Group. Today I'll be answering some common questions about Botox, a minimally invasive, effective solution to transform your appearance from tired or exasperated into a more rested, relaxed, and youthful self. Injections are needed every 3 to 4 months on average to maintain results. From consultation to checkout, you're looking at around 20 minutes. Once we know where you need the injections and how many units will yield the best results, it's a matter of simply repeating the same protocol at future visits. You can expect to notice some improvement in as little as 2 to 5 days, although it may take up to 2 weeks to attain maximum benefit. Downtime is non-existent. You can return to your daily routine immediately after the procedure. This means you can come in on your lunch break, go back to work, and never miss a beat. Botox is FDA approved for frown lines, which are those 11s between the eyes. It's also approved for forehead lines and crow's feet at the outer eyes. It's important to note that Botox acts primarily on wrinkles that arise with facial expressions such as smiling, grimacing, squinting, or raising the eyebrows. It's less effective on wrinkles that are present at rest. However, with such fixed wrinkles, that's where filler comes in handy. Cosmetically speaking, I've used Botox off-label for eyebrow lifts and the bunny lines, which are those wrinkles on the nose. I've used it for people that grind their teeth or clench their jaw. I've also injected people that have excessive sweating due to social anxiety, and it really helps with that. Not really. Each injection feels like a pinch. If you're concerned about pain though, we can numb the areas to be injected with ice. We can pre-treat with a topical anesthetic cream, or we can use a vibrating tool which does a good job of distracting you from the injection. My goal is to reduce fine lines and wrinkles while maintaining a natural look. When you see people who look frozen, it's probably because their injector used too much Botox. My philosophy when it comes to Botox is less is more. Not only does that save you some money, but it also allows you to come back for touch-ups should you feel like you need more. The most common ones include muscle weakness, which is the intended effect, as well as slight bruising, bleeding, redness, swelling, but none of these should last more than a day. Most people see Botox as just a temporary fix, but this is not the case. It can prevent new wrinkles, which is why you're seeing lots of people in their early 20s starting to get it, and it can improve skin elasticity. This term describes a medical professional with a long track record of Botox injections who understands facial anatomy, including major nerves, blood vessels, and musculature. It's very important to have this procedure done by a master injector because you can easily end up with complications otherwise. The short answer is yes. Botox is the most recognizable brand name of botulinum toxin type A. It's a neuromodulator secreted by a bacterium that causes muscle paralysis. But don't let the word toxin scare you, as it's been FDA approved since the late 80s. Our price is currently $11 per unit, which is very competitive in this market. Sometimes we do run deals. A typical session is about 15 to 30 units, but because insurance doesn't cover cosmetic procedures, this is typically an out-of-pocket expense. Not at all. In fact, more and more men are getting this procedure done. Speaking of which, here are some before and after photos of myself. I hope you enjoyed this discussion and learned something new. If you are interested in getting Botox or have any further questions, please don't hesitate to give us a call and schedule an appointment. We look forward to seeing you soon.